This is KTVO's Good Morning Heartland.
And welcome back. May is National Stroke Prevention Month, and knowing if you are at risk for stroke is highly important because many risk factors can be modified and controlled. To learn more about the signs and ways to reduce your risk, we have Dr. Wesley Ryle from Kirksville Family Medicine here this morning to kind of break it down for us. How are you doing today?
I'm doing great, Ella. How are you doing?
I'm doing great. So first of all, to kind of simplify it, what is a stroke and what does it do to your body?
So Ella, a stroke basically is a syndrome that happens when your brain either has a leak in a blood vessel in it and you bleed into the brain, which is the less common kind of stroke. And then there's the more common kind of stroke where basically you essentially have a clot in one of the arteries of your brain where your brain doesn't get enough oxygen and blood flow to it, causing loss of function.
Okay. And what is the number one risk factor associated with stroke?
Without a doubt, hypertension, so high blood pressure, long-standing high blood pressure really seems to be the major risk factor that people can control.
Okay, and when it comes to a stroke, I know there's signs when people are having a heart attack or anything. What are some signs to look out for, knowing and how to differentiate from a stroke and a heart attack?
Sure. So, the big differentiator there is that strokes are not going to cause chest pain or shortness of breath as a general rule of thumb, okay? But what strokes are going to do is usually cause some sort of loss of function. Now, that can be a loss of ability to talk or a loss of strength, inability to move a limb, inability to feel a limb. Sometimes the symptoms can simply be confusion, confusion or inability to rouse someone who's, sleepy and, won't wake up. Sometimes that can be, a sign of a stroke.
And when it comes to strokes and men and women or age, does it matter? Are men at higher risk of having stroke? Is it older people? What is that?
Ella, everybody's at risk for having a stroke. Certainly the age, age is very important, okay? The older you get, the higher risk you have of having a stroke. The lifetime risk of having a stroke, the estimates vary, but it's about 15 to 20% lifetime risk, okay? Now, obviously, as we go through our life, we accumulate that risk. So, a 20-year-old's at extremely low risk, in the next 10 years to have a stroke, okay, versus a 70-year-old is at significantly higher risk for having a stroke. Gender seems to have less to do with stroke risk.
Okay. Now, according to the Stroke Prevention Association, they had released a way to kind of look out for and keep in mind to hopefully save a life when it comes to stroke and stroke victims, and it's called F.A.S.T, and each letter stands for something. So the first one is F for face drooping. What does that mean?
So very often when someone has a stroke, a common symptom is going to be that they're going to have either some facial droop or some paralysis of the face where they can't, they can't move certain muscles of their face. They may have difficulty, that comes later in the FAST, but may have trouble talking simply because the muscles of their face that allow them to talk also aren't working right. You may notice that somebody's smile is uneven, that's new. They can't pull the corner of their mouth up, so they have sort of this crooked smile, or they can't keep their eye open, and those would be sort of part of that facial assessment of stroke.
All right, and the next one is A for arm weakness.
Right, so A is for arm weakness, but really remember it can be weakness anywhere. It can be leg weakness, arm weakness, weakness of a limb, or inability to feel, sudden loss of sensation of that limb too. So it can be any side. Usually it's just going to be one side. Okay. And this is, again, it's important to remember this is something that's very acute. It's sudden. It's not, often I see people that have some tingling in both arms and that sort of thing. And that's seldom a stroke. They say, for weeks I've had this tingling.
Right.
That's really not what we're talking about. We're talking about I was fine and then boom, I can't, feel my arm.
Okay. And what I've also noticed with people that have had a stroke is their speech gets slurred. So talk about that. That's S for speech.
Yeah,
difficulty.
Right. So that's a very common symptom of a stroke too, is somebody will have sudden onset of either inability to talk, and that can be just complete what we call aphasia, where people cannot speak. They want to, they know what they want to say, and you can almost see them kind of start to try and get word, but just nothing comes out. They just can't talk. Or they can also have slurred speech, again, because of those, a lot of it has to do with the muscles that are required to have clear speech. They lose that function. Or alternatively, Ella, people may have sort of nonsensical speech. So that's something that people will often have. Their family members will bring them in because all of a sudden, mom is kind of talking gobbledygook and not making any sense, and that's really scary to people.
Right. And finally, of course, T is for time to call 911. No matter how small or acute you might think that the stroke is, I mean, it could be a life or death situation. So call 911, get an ambulance, go to the hospital, and get help.
Right. Absolutely, Ella. So this is probably the most important point of all of this is time is critically important, okay? It's important to know there are things that can be done for a stroke that can have a big impact on the patient's final outcome. But that has to be done, that there's a medicine that can be given. It has to be given certainly within, the first 4.5 hours or so after a stroke, ideally before 3 hours, and ideally even sooner. The sooner the better. The sooner you give this medicine, the better it works and the safer it is to give. So really, once a stroke starts, the time clock starts, and there's a certain evaluation that has to be done in the emergency room, and that can take some time. So it's very important to not delay. If you think a loved one's had a stroke, you need to get them into an emergency room right away.
All right. Well, thank you so much, Dr. Ryle. What we'll do is we'll post everything on our website at heartlandconnection.com. We'll also link up your information with Kirksville Family Medicine as well if they have any questions or concern, okay?
Thanks, Ella.
Thank you, and we'll be right back.